Let's talk about palpation, the skin. Palpation is the use of the hands to touch, feel, press, and manipulate certain parts of the patient's body in order to discover abnormalities. From these abnormalities, the physician infers the location, nature, and severity of the patient's illness. Strictly speaking, examination of the pulse is a part of palpation, but because the pulse is so important of itself, it is usually discussed separately in Chinese medicine. Palpation of the skin. The purpose of palpating the skin is to determine whether the skin is cold or hot, moist, well hydrated, or dry, dehydrated, swollen, or otherwise abnormal. If the skin feels hot initially but becomes less hot with sustained palpation, then heat is in the exterior. If the skin does not feel particularly hot initially but becomes hotter with sustained palpation, then heat is in the interior. Cold skin generally suggests strong yin cold or deficiency of yang qi. If the four limbs are cold but the chest and abdomen are hot, then strong yang heat has expelled yin to the exterior, producing a condition of true heat and false cold. Well hydrated, smooth, and lustrous skin reflects ample body fluids, sufficient to ensure nourishment of the exterior. Dry and dehydrated skin reflects insufficiency of body fluids and loss of nourishment for the exterior. Pressure on an area of swelling can differentiate between water edema and chi inflation. Press hard enough to make a depression, but not so hard to cause injury, and let go quickly. If the depression remains for a long while, the swelling is edema. If it fills up promptly, it is chi inflation. Pressure on a part of a swelling can differentiate between yin and yang and determine whether there is much pus formation. If the lesion feels hard to pressure, and is not feverish and has a flat bottom, it is a yin lesion. If it is feverish, tender, and has a tight bottom, it is a yang lesion. If the entire swelling is hard in general, therefore is no pus formation. If the edges are hard but the center is soft, there already is pus formation. Here we see in the temperature of cold and heat. If it is a cold feeling, then it is a cold pattern. Four limbs cold, both spleen and stomach yang deficiency. If it is in the loins, a lower back, or feet is cold, then it is kidney yang deficiency. If it is a lower abdomen cold, then it is spleen yang deficiency. Now for heat, if the temperature of the skin is hot, then it is damp heat. If the skin hot on first touch ceases to feel hot if the pressure is maintained, then it is exterior wind heat pathogen still on the exterior. If the skin over a blood vessel is hot on medium pressure but not on a heavy pressure, then the interior heat in middle jaw or just heat. If the skin feels hot on heavy pressure, which nearly reaches the bone, then this is empty heat from yin deficiency. Now for skin moisture and texture. If there is moist skin, then it is exterior wind. If it is moist without exterior symptoms, then it is lung qi deficiency. If it is dry skin, then it is blood deficiency, lung yin deficiency. If it is a rough skin, then it is a B syndrome from wind. If the skin is scaly and dry, then this is exhaustion of body fluids, severe deficiency, liver blood dryness. If the skin is swollen and pitting, then this could be water swelling from spleen or kidney yang deficiency. If it is a swollen skin but not pitting, then this could mean qi swelling from damp or qi stagnation. Thank you for your attention.